think everybody who was interested earlier has come in already, so we might still have a few people stream in. And so we'll open the doors when they come. My name is Jason. I'm an audiologist, and I've been an audiologist for almost 15 years now. So I'll give a bit of an introduction for myself, and then we'll get started with our talk. I practiced in a bunch of different environments. I started off actually working with kids and babies. So I was a pediatric audiologist for the first 5 years. Then I've worked in ENT practices, different larger corporate environments. I work as a director with the clinical department here at Hearing Solutions. Quick question, can everybody hear my voice okay right now? No. My voice is a little too soft? Maybe I'll raise it a little bit. How's that there? Is that better? Okay. If you guys have any trouble hearing me, please interrupt me, just so that you're able to catch the information. The first topic we had was hearing health and the brain. People ask many more questions these days about what hearing loss has to do with the brain and how they're two topics that go in hand. So the first thing that I get asked a lot of the times is, why are we talking about the brain in a hearing clinic or in a hearing setting? 50 years ago, if you went to see your primary care physician and you said, hey, I have some hearing trouble and have had it for some period of time, what happens as I get older? Is there any specific impact? Are there any things I should be looking out for? And at that time, we didn't quite have the research we do now and all the brain imaging and the studies that we have. And so the response might have been, well, if you can't hear, you just can't hear, right? So your communication would be affected, but we might not be concerned that there's any other long-term impacts. In the last 20 years or so, it's really changed how we've talked about hearing loss and how it affects aging and specifically how the brain functions. And we have much better data to show that when we have hearing loss, it does have impacts on the rest of the body, and everybody is different, of course, but that the trend is for people to get their hearing tested more consistently, especially as we get older. And I'll share some of the reasons behind that. Okay. One of the first concepts is that hearing happens within the brain. Okay, we oftentimes think of hearing as something that is happening within the ear itself, and it's true. But the ear is only an organ that captures sound for us and transmits it to the brain. Without the brain, there is nothing to process what we hear. Okay, so the brain is the crucial link between everything that's happening on the outside versus what we end up perceiving. Okay, so I know some of the picture here is a bit washed out here, but the ear is split into different sections. There are parts that we can see that are more on the outside. And then there's the eardrum, which we're mostly familiar with. That's sort of the middle portion of the hearing system. And then there's a crucial section that's deeper within the hearing system called the inner ear. And so this area starts to contain the nerves, the nerve fibers, and the actual transmission pathways for sound to get to the brain. But all of it ultimately ends up feeding into different sections of the brain that are just there to process hearing and auditory information. So most of us don't have eyes on the back of our skulls. And so for us to be aware of what's happening in the world around us, hearing is how we're able to stay connected. Imagine you're walking down in the street and you hear footsteps behind you. The only reason you would know that somebody's behind you is not because you've seen them, but because you've picked up that somebody's walking behind you. Even when you're driving down the road, we take for granted how important our hearing is to us, right? So we oftentimes focus on what we can see, but really if there's a policeman behind you or there's an emergency vehicle, there's a siren going off in the background, there's even a car that's in your blind spot, you would be shocked at how much information you're relying on from your ears to help you navigate when you're on the road. And so when we go to bed at night, most of us shut our eyes. None of us really shut our ears unless you're putting earplugs in. And so your sense of hearing is one of those senses that never really shuts off. That's why your alarm clock works, right? When it rings, you wake up immediately, or if something stirs in the house, something drops in the middle of the night, you just shoot up because your brain is constantly processing auditory information even when you're unconscious. It's how we survive. And so hearing loss is really one of those first checkpoints in our lives where the sense of hearing is starting to get shut down in some way. Because before that, the ear is just processing everything that's coming through. And so this 24/7, 365-day connection to the world starts to get interrupted in some way. The text is small here, but I'll go over what we're looking at. So this is from The Lancet, which is one of the world's most reputable medical journals. And in the last, I would say over the last 5 years and more, they've had a working group of scientists, and they've published guides about hearing loss and its effects on things like dementia. Okay? And so this is one of the images here from their latest publication, which is about, I would say, about a year and a half old now. And it takes a look at the different risk factors for dementia as a condition. And so you'll see here things like alcohol, obesity, hypertension, diabetes, traumatic brain injury, physical inactivity, depression, high LDL cholesterol, and at the very top here you see hearing loss. Okay, so these are some of the known conditions that are quite common, especially as we get older, that we have seen in the research contributes in some way to the risk of dementia. And so hearing loss is very prominently right at the top there. When I first saw this, I was actually quite surprised. You see that traumatic brain injury actually ranks lower than where hearing loss is as a risk factor for dementia, okay? Or even things like smoking or drinking, we know have harmful impacts onto the brain, especially over a longer period of time. And for it to sit below hearing loss as a risk factor is quite surprising to me. This is talking about risk. So when I talk about dementia and cognitive health as we get older, I don't want to sort of go into this sort of scaremongering talk where people start to say, I have hearing loss, I'm going to get dementia. That's not how it works. So this is talking about the risk in a population. We know, for example, that if you use tobacco, then your risk of certain cancers goes up significantly, right? We've known that for many years. And so in the same way, when there is hearing loss, then it starts to have an impact on the risk of how the brain functions over a longer period of time. And that contributes to certain conditions like dementia, for example. Is that clear for everyone? That makes sense there? Okay. So this is an infographic that's based on one of the landmark studies on dementia and hearing loss. This comes out of Johns Hopkins University. Back in 2011, they did a landmark study. They followed over 600 people over a course of many years. And they took a look at the outcomes, the dementia outcomes across this population. And so what they found was quite surprising. And so on the left ear, on the left side here, you see sort of normal hearing and the risk of dementia, for example. What they had found was as people acquire hearing loss for a longer period of time, and as that hearing loss becomes more significant, it seems to have an impact on the risk of those individuals acquiring dementia over a longer period of time. And so we can see here with a mild hearing loss, with a moderate hearing loss, with a severe hearing loss, the risk tends to go up, okay, which in many ways makes sense logically. The more that we're not hearing, the more that the brain is at risk of being disconnected from what's really happening around us, as we talked about earlier. Okay, and so if the ear and your hearing is a gateway to your brain, then if you're shutting the doors on all the sound that you're supposed to hear, you're becoming more and more isolated from what's actually happening in the world. So oftentimes, especially in clinic, when I see patients, we always try to simplify things down into a few key principles, okay? But the reality is that the brain is incredibly complicated, and that the hearing system is also incredibly complicated, and that they're both connected at many different points, and that the rest of the body is also involved. And so no two people have the exact same progression of these sorts of effects, right, from hearing loss into the brain. And some of the stuff that we're looking at right now is still in the process of being researched. The more that we find out about things like hearing loss and dementia, the more that we realize we don't know a lot of things. But if we take a look at all the research and we try to sum it down into three key principles of why hearing loss and dementia might be related, these are the three that we'll find in research that more people have started to agree upon, okay? So the first one is sensory deprivation, and I'll talk a little bit about that in a moment. The second one is mental load and mental fatigue. And finally, the third one is social isolation and reduced engagement, okay? None of these are earth-shattering, but we'll spend a little bit of time breaking them down. Okay, so sensory deprivation. We know that there's large parts of the brain that are there to receive the information from the ear. And very much just like a muscle that we continuously exercise and we move, that muscle becomes stronger. Okay, there is this sort of use it or lose it phenomenon with a lot of the parts of the body. So when certain areas of the body get underused or understimulated, the body's way of maintaining that area can oftentimes change. And so we have seen from some studies that do imaging and they do scans with the brain that some individuals, when they have a significant reduction in the amount of sound that they hear, there's certain areas of the brain that start to change. Okay, it's not getting the same amount of stimulation and exercise from the ear itself is what we suspect. And so those areas can start to shrink or thin or change in terms of the structure. And so this very much is a topic that we're focusing a lot these days on doing more research on, is what happens to these areas of the brain when you understimulate it, when you take away that information. But we think it is one of the major factors behind why the brain is at more risk of changing. Okay, secondly, increased mental load and fatigue. And so this shouldn't come as a surprise to many of us. And so if you've ever had your hearing tested, or if you have a history of hearing loss, or even if you're wearing hearing instruments, we know that hearing becomes much more effortful. And it's because things become less and less clear over time. Picture yourself in a restaurant. There's a group of 10 people talking, okay? If you're able to just quickly pick up what people are saying and you're not second or triple guessing what the other person is saying, you're not trying to read their lips or look at their face, you're much more engaged in the conversation. You're able to think about how you want to speak, the joke you're going to tell, you're able to memorize the information that people are saying. And so there's much less load on your brain. When you start to have a harder time hearing what's being said, the fatigue is something that sets in. I used to work with a lot of children and a lot of my patients who were teens, for example, who would wear hearing instruments and go to class. they would always tell me how tired they are at the end of the day. All the kids are going outside and they're playing in recess and they're just full of energy, and they would be so tired because the whole time in class, they're not just taking notes and figuring out, what the material is. They're trying to actually just listen to the teacher and figure out what the teacher is saying. And a lot of times the teacher has their back towards the children, right? And so they don't have that same ease of listening. And so they would always report that they'd be consistently tired. And so that doesn't go away as we're adults dealing with things like hearing loss, is that it does put more fatigue and pressure on the brain. And then finally, social isolation and reduced engagement. This one is very interesting because when I talk to my patients a lot of the times, this is one of those things that sets in very gradually. It's not that when we start losing our hearing that we sequester ourselves in a closet and we don't talk to anybody. But what will start to happen, what we see both from the research and subjectively when we talk to people who have more trouble hearing, is that they just don't engage in the same way. Even if they're going out and having dinner with friends and family, many of them become more and more withdrawn. And it's easy to see why. If you're in a group, somebody says a joke, you have no idea what's being said. Sometimes it's difficult to get back into the conversation. It's hard to ask, hey, what did they say? You don't want to interrupt the flow and the process. And so you just sit back. And eventually when that happens enough times, you just become tired and you don't want to participate in the same way. And if there's no participation, then, well, what's the point of getting together with people, as the reasoning goes? So we'll start to see these sorts of changes set in gradually. I put this here because one important concept is that the brain is already changing as we're getting older. Okay, so unfortunately, it's part of the human experience. The question is not if, it's just a question of when. Okay, for example, we know that the volume of the brain for many individuals starts to go down as we get older. It's why doctors are more concerned as we get older and as people fall. Imagine if there's more space between the brain and the skull. When you fall, your brain is rocking and shaking back and forth in your skull, and that puts you at risk of more of a concussion or a brain injury. If your brain is larger and it's filling in most of your skull, there's less room for the brain to slosh around, and that's why when we fall, we hit our head when we're younger, it's oftentimes at less risk. Okay? So hearing loss sometimes is sort of the straw on the camel's back, as it were. Because if the brain for some individuals is already at risk of changing or shrinking from its prior shape, and then you add on hearing loss and you put more and more pressure on the brain, for some people, that's what tips their brain over into deteriorating in a different way than if hearing loss were not present. Does that make sense for the progression there? So overall, I would say these are the concepts that we're still studying right now and doing research on. But if I have one take-home message, it would not be that we should be, scared to the point of inaction. I think, in fact, all of this information is most helpful when it's shared with society as a whole. Because what we're trying to do in the world of hearing is to let people know, hey, hearing is an important part of our overall health. And this information is fairly new. It's not until the last 15 to 20 years that we've really started to talk about how the brain is at a better chance of aging in a healthy way when we're able to hear clearly. And in the past, we might have just totally ignored the impact of our hearing on the function of our brain. And so if there's a message I can leave with everyone, it would be that as you get older, it's important to monitor your hearing. A lot of the times hearing loss is already there, especially as we cross over the age of 60. You can start to see that the statistics for hearing loss and the chance of having hearing loss start to go up quite rapidly. It's just that a lot of people never get their first hearing test. And so out of sight, out of mind. If you never get it tested, and you don't really have anything that shows you that your hearing is changing, for a lot of people, they assume that their hearing is normal. And so we're trying to move away from that and make hearing screening, hearing testing a part of what people regularly do as we get older. What's the impact of treating hearing loss, and how does that have to do with topics like dementia? We still need much more research and data to show some of the impacts of treating hearing loss on those specific risks related to dementia. There was a study in the last couple of years that came out, which was very interesting. It was a large study, and within this study, they followed people who had heart disease, okay? We know from research that people who have heart disease are sometimes at higher risk of the brain changing. The heart is so important to pump blood throughout the body, and if there's an interruption to the way that blood travels throughout the body, you can imagine that it would have an impact negatively on the brain. The brain needs to be continuously fueled with oxygen and nutrients, and so poor blood flow, poor cardiac function is a risk factor for things like cognitive decline and dementia. The interesting thing in this study was that when they tracked these individuals who had heart disease, who are at higher risk of potentially cognitive decline, when those people treated their hearing loss, it had a substantial impact on reducing their cognitive decline, okay, over that 3-year period. In some of the measures that they had, it was a 50% reduction in the rate of cognitive decline over this 3-year period compared to those high-risk individuals who did nothing about their hearing loss. So again, it's pointing us in this direction that when we use things like hearing instruments, we're trying to reconnect ourselves back with the world. Okay, so hearing instruments ultimately help the brain stay fit. It's almost a form of exercise, as we could imagine. And so it's a whole complicated process, but really, the better you're able to hear, the more likely you're going to be aware of what's happening around you, the more you're going to engage in the everyday conversations. And if you're socially active, if your brain is being stimulated by this information, well, it helps the brain function in the way that it should. Okay, and so the take-home message, even from one of the lead authors of some of those dementia studies, has advocated for early treatment because of what we've seen. And I've got a quote down here. Franklin says that the earlier hearing loss is treated, the easier it is for the brain to adapt and to return back to that sort of functioning it should be having. Does that make sense for everyone here? Okay.